Hello everyone. Good morning from California and good evening in India and Europe. Well, we have been doing a lot of bite-sized sessions. Today we are going to be talking about PCOD. If you have been following us, we have been doing on PCOS, but people get confused. What is the difference between PCOS and PCOD? So today we are going to be talking with Vaidya Shikha Prakash, who will be joining us in 1 second or a few seconds, if I can figure this Insta out, and talking about PCOD. The difference between the PCOD. Well, today we're going to be talking only on PCOD, what the causes are, what the symptoms are. And Vaidya Shikha Prakash runs a hospital, an Ayurveda hospital in the foothill of Himalayas. So while I'm waiting for Vaidya Shikha Prakash to join us, if there are any questions, anything that you want to give us, any feedback, comments, please feel free to give it to us. So I am waiting for Vaidya Shikha Prakash to join me in 1 second. And then she'll talk about PCOD. Any questions, please feel free to put it in the comments as usual. So let's see Vaidya Shikha Prakash, if she has joined or not. I don't see that right now. So let's see if she is able to join us and we can start the discussion on PCOD. Let me see if, okay, I think I see her join. And any questions you have, you are welcome to put it in your comments. Like I said, hello, how are you? Okay, so we see you, Vaidya Shikha. All right, I just introduced you for briefly that you run Vaidya Shikha Prakash focuses on women's issues, and she runs a Ayurveda hospital in the foothill of Himalayas. So today we are going to talk about PCOD. Vaidya Shikha, welcome, and please, you can start.
Yeah, thank you so much, Amita, and thank you to Nourish Doc for this session. Well, PCOD is one of my most favorite topics because this is one disease which is, a very common disease in today's era. And if you talk about even in India, so every fourth girl, when you talk to them, they would have some symptom or the other which would relate to a case of PCOD. And this is quite an alarming situation because I think this is a disease of a higher socioeconomic status and people who are much more educated. And surprisingly, people who are more educated and more from a better strata of the society are much more unhealthier. So it clearly depicts that this disease is very closely related to the kind of choices we make towards our diet, our lifestyle, and the kind of thought processes we have. So for today's topic, when we talk about what is PCOD, I would say it is a metabolic disorder largely contributed because of the choices of the food and lifestyle that we make. And the essential diagnostic criteria for this disease would be having a cyst in one of the ovaries, either right or left ovary. So when there are multiple cysts, so we call it polycystic ovary. So that is one essential sign, and this can be diagnosed through a ultrasonography or any other radiological investigation. But again, just having cyst on your ovary will not confirm that you have PCOD. Apart from that, secondary would be there would be some ovulatory dysfunction in your menstrual cycle, that maybe you're not having regular cycles. And if you're having irregular periods again and again, or maybe you're having painful period for that matter, that can also be a sign of PCOD. Third would be excessive, production of male hormones in a female body. Female body also has male hormones, but if there is a more amount of androgens in your body, so that is again a criteria for PCOD. So three basic criterias that was formulated by Rotterdam Diagnostic Criteria. Would say like one would be irregular periods, second would be higher testosterone level or the male hormones, and third would be one or the other ovary is polycystic in nature. So this is the essential criteria.
So when you said the higher testosterone levels, how would you someone is having a PCOD, what would be the
See,
like what would
See, the symptom by which one can identify that the male hormones are increasing in one's body would be with excessive hair growth on face, on the chest, or the other parts of the body, because female bodies don't have much of hair growth. But when the male hormones are, at a higher side, so we have excessive hair growth, then there's hoarseness of the voice. You have central obesity, that you tend to gain weight around your waist area. So these all are signs of your higher level of testosterone levels.
Okay.
So yeah.
Okay.
And then
Someone
it
is
can
asking
be,
a question. Symptoms of cyst in ovaries. That's the question that's coming up.
see, there would not be any particular symptom where we can say, okay, there would be a cyst in the ovary. Sometimes that is painful, but generally, there is a difference. When we say cyst in ovary, that could be because of the pain, that the torsion of something else. So that is a different thing. A cyst in ovary and polycystic ovary is totally a different thing.
I see.
Polycystic ovary is when you have small cycles of, cystic changes on your ovary. So that is different. But cyst in ovary is over like a water kind of structure on your ovary where it can, because of it can just twist around and all. So cyst in ovary would definitely have pain, and you would have excruciating pain actually. So that can be easily diagnosed. When you can specify on the right side or the left side, you have pain during a menstrual cycle. So that can be ruled out. But PCOD generally doesn't have pain as such. Yeah.
But it'll be irregular menses. That's what you said.
Yeah,
And
irregular menses, and see a lot of females who are obese in nature and who have a very bad lifestyle and have sedentary lifestyle
yeah,
tend to have very irregular periods. So yeah, they can screen themselves for PCOD. But a lot of cases who come to me, they are self-diagnosed cases of PCOD. I think it is always very important to get yourself, checked, get an ultrasonography, and get yourself investigated before diagnosing yourself with PCOD.
sure, sure.
Yeah.
There was a question someone asked if there are any other reasons for irregular periods. Of course, getting pregnant is one of the reasons, which I think all of us know. But I mean,
Yeah, see, sometimes people say your genes are to be blamed, but I don't actually believe in that. Yes, we all have genes from our parents, that is how we are made.
yeah,
But again, if you water those genes, then only you can say, okay, that is something we acquired from my parents. Like I come from a family where my father has, diabetic issues, hypertension issues, and all that. But if I don't take care of myself in today's time, so I'm more prone to develop all those diseases.
yeah,
So yes, 24% of women have shown that there's a history from their mothers or sisters, something like that. But again, if you keep following a healthier lifestyle and you keep a check on your metabolic health, your mental health, the kind of food you choose to eat, so that can really have a big time impact, because there are a lot of underlying causes when we talk about PCOD, because it can be insulin resistance, it can be fatty liver, it can be your I think stress levels. So there are a lot of things. So there has
yeah,
to be some underlying cause about it.
sure, sure, sure. Well,
At the age of 19, not pregnant women, at the age of 19, if you're anemic, maybe if you have vitamin D deficiency
yeah,
or you're obese, so there can be so many reasons. We have to evaluate, about if there can be thyroid issues. So there can be so many issues. So there's not one issue, it is a multifactorial disease, and there can be endless issues that might cause PCOD in a particular patient. So we need to understand that.
yeah.
Does coffee affect menstruation in pregnancy? Yes, it does. I don't recommend coffee and tea much to anybody.
Oh,
Yeah.
even tea? You don't recommend tea also?
Not really, not much.
Okay. What about herbal? Well, I think we have a segment of, we have 3 segments, by the way, after this. So we don't want to take Dr. Shikha's all the questions today, but we are welcome for questions. Today's topic is what exactly is PCOD? What is the cause and symptoms? So these 3 things, but we are open for questions for sure. Anything else you
Yeah.
want to add? Okay. Anything else? Anyone has a question, and if they want to see any topic, you're welcome to tell us.
I think basically obesity is something that we need to address in terms of PCOD, because there was a study conducted by All India Institute of Medical Sciences where they clearly showed that more than 60% cases of PCOD were obese in nature,
Yeah.
and 50% out of them had an underlying fatty liver, which was again underdiagnosed, and 70% of these young females had insulin resistance. So all of these are interrelated. So definitely somewhere if there's a underlying metabolic disorder, so
Mm-hmm.
all these things are, they just tend to develop in your system.
Yeah.
And any disease in today's era is more to do with the chronic inflammation that is underlying, and we need to address the cause.
Okay, so someone saying changing lifestyle, what means? We have a separate segment on exactly what to do. We are doing it every Wednesday, 8:30 p.m. Sorry, 8:30 a.m. Pacific Standard Time. I don't know which time zone you are, and 9 p.m. in Indian Standard Time. So we will be talking about the lifestyle. These are just 5-minute segments, just to give you an introduction, right, Dr. Shikha?
Yeah, yeah. But anybody who wants to know anything about PCOD, or they think they have any symptoms related to PCOD, maybe they're missing on their periods, or they're having some extra facial growth, or they're just feeling, some bloating issues or heaviness all the time, or maybe are feeling mood swings, all of that. So they can just go and get the ultrasonography done, and that can really help.
Okay. The lifestyle
Yeah.
part, two people have asked this question. We are talking about lifestyle on November 4th. So same time.
Yeah. But lifestyle, since people are asking, I would just like to say, make your lifestyle as simple as it can be. Don't fall for any major fads around you, like what you should do, what you shouldn't do. I think till the next time we speak or we meet, let's fix our sleeping schedule. Like sleep at one particular time and wake up at the same time. So
Yeah.
till then, this is one lifestyle tip for anybody that I would give, and do that. And I think everybody will feel better after doing that, because if you are sleeping right, you will fix a lot of your issues that is going in your body.
Or sleeping right. You're saying sleep.
Yeah.
Sleep is
So
very
the
important.
first thing that we can all address till we meet next is fix your sleep.
Okay. Okay.
Yeah.
So what about effective treatments of PCOD? There's a lot of questions coming. We have that session on November 11th, Ayurveda and PCOD. Suddenly
Yes.
weight loss and increase. Is it? That's the question someone asking.
We'll address all these questions in times to come, and I think we are done with the introductory part of PCOD
Yes.
today. Yeah.
Yes. Well, thank you so much. This is great engagement. We just thought we will try this segment, and it's great to have people to get so engaged and ask these questions. Thank you so much, Dr. Shikha, for joining. We will see everyone next week, exactly the same time. And the topic for next week is the difference between PCOD and PCOS, right?
Yes. Yeah.
That's what we said. Okay.
All
With
right.
that,
Thank
thank you
you.
so much. Thank you.
Yeah.
Bye-bye.
Welcome. Bye. Bye.